So, good morning, everyone. And I want to take a moment to express my condolences to the family of the woman who died over the weekend, which brought us up to 133, and to all the families through this difficult time with everything going on around us in this world. And, to lose a loved one is a tough time. So, to the 133 families, my condolences and prayers go out to you. As of today, we have 2,531 positive cases of the coronavirus in Albany County. 409 people under mandatory quarantine. That's down from 441. That's an increase of 10 positive cases overnight. We had 9 positive cases yesterday. Among the new positive cases, we know 2 have close contact to a positive case. 4 people reported traveling out of state, and 4 didn't have a clear source of an infection. 9,701 people have now completed quarantine. Of those, 485 tested positive for the virus and have recovered. That's an increase of 18. There are now 12 people hospitalized. It's up 1 from yesterday with a hospitalization rate of 0.47. That's the one thing under the control room that we watch every day is the hospitalization rates. And as you know, the last couple of weeks, we're down below 5, and then we'd go up to 7, back and forth. Again, that's the one that we're tracking to see how the virus is affecting people now versus almost 6 months ago. And I can't believe, Liza, we're going to say almost 6 months ago this all started for us. But yesterday's rate was at 0.43%. We currently have 2 people in the ICU. And again, that numbers goes up and back and forth. Over the last 5 days, there's been an average of 8.4 new positive cases. Yesterday it was 9.4. So again, we're telling everyone, whether you have signs or symptoms, please go out and get tested, do the right thing. That's the only way we're going to track this. This is the only way we're going to know how the virus is still lingering out there, because it's still there, it didn't go away. So please, by all means, Albany doesn't even ask you for insurance. It's free. The state pays for it. So that number is 1-888-364-3065. As always, our mobile testing site at 518-465-4771. And the Rite Aid site in Colony, you need to go online. It's changed a little bit. It's at www.walgreens.com/findcare/COVID-19/testing. It's we're putting that up there because I've talked to a few people. Guy Tom called me the other day and he couldn't get online. So again, please, it's up, and try the link. Priority 1 in Gilliland, as always, for the antibody testing or getting tested, the area code is 518-867-8040. As I've continued to say and repeat myself like a robot, continue to do the 4 things. Wear your mask properly. Everyone keeps talking about it, and cough into your arm, clean your hands, stay 6 feet apart, do the right thing, and stay masked. And again, we'll get through this. Wearing a mask out in public helps stop the spread, and people also learn from their peers when they see everyone having them on. And I brought my son Ty back to Boston on Sunday. He's been home since this, and they're still working remotely. And it was nice to drive around Boston to see people having their mask on and doing the right thing. And it's just reassuring. And he showed me where the beach was, and people would get up and they put their mask on. So it's good. It's something that we have to get used to, and unfortunately, it's going to be this way for a while. Not trying to scare people out there. I know. Shut it off now. Turn it off, because people get paranoid. They think we're trying to fairmonger. They think we're trying to scare people. We're not. It's the world we're in. It's the reality that we're in. That's why I said early on, reimagine what the county's going to look like, what the country's going to look like going forward, and we'll get through this together. Again, we knew cases were going to go up when school opened up. So I know SUNY has been on top of this. Chancellor Jim Malatras has been on top of this. We talked about it at UAlbany with President Rodriguez a couple days ago, probably last week. Everything gets together. But again, another SUNY school suspended. They went from 100 up to over 500. It's going to happen. It's going to happen. Everyone gets tested. Unfortunately, it's going to continue to happen. I got a lot of pictures from people sent to us on Facebook about parties going on in Albany, and I can tell you President Rodriguez was on top of it. They're on top of it with the facility and the faculty that work there to address these issues. I know a lot of these kids don't get it, and it's one thing I'm going to point out on the smart board. I know that age group. You have no signs or symptoms, but you're spreading it, and we're not going to get through this if you don't do the right thing. You did the right thing at your home for the last couple of months. Please do the right thing. You're a fabric of our community. We want you here. We want you to try to enjoy somewhat of a normal college experience, but we need you to be good neighbors. And please, by all means, rent the Netflix, Mr. Rogers, and watch it with Tom Hanks, and learn from that. Be a good neighbor, do the right thing, and we'll get through this together. So again, thank you to everyone that's been partnering up with us on this. Again, we talked about the upticks and the hospitalization rate, the upticks and the numbers going up. But between August 14th and August 24th, we had 7 county residents hospitalized. But since the 24th, we've seen that number slowly start to tick up again. And that's the one thing, again, that alarms us. Another thing that should be pointed out is the number of residents who have been hospitalized since August 14th. That total number of residents has gone from 297 to 316 as of today. Again, I don't want to send up the alarms, and if it scares you, don't watch it. We're not. I don't want to speak for Liza and I, but we're not trying to scare people. We're just trying to educate people, do our jobs to stop the spread and get back into some type of normalcy life where we can get out and be productive and continue to move the world forward. And we can only do that by you doing the right thing, and most people have. That's why I think our numbers are where they're at. I think the governor said it correctly. We're below 1% on a national level compared to other states, which is good. But we need to continue to work at this, and we need to continue to educate people as we go forward. And I'll show you something on the dashboard, but I know our Facebook and Twitter is updated daily with the positive graphs, but you have to remember also too that it's a snapshot, and time things change. I know people are used to, they want that rapid thing on their phone. They want to be able to go, well, no, state dashboard says this, yours is saying that. Again, it takes time. We have to bring things together in the data, and we got to make sure it's right. And I can assure you, Dr. Will and her team do a phenomenal job tracing people down, and sometimes our numbers go up or they go down, depending where they live, and then they trace it back to another county. So that happens a lot, and which is good. That means everyone's doing the epi people are doing the right job of mapping and tracing. Again, the 20-year-old to 29, which I identified early on with the population, the positive cases have jumped by 19 in the last week alone. It's the one thing I keep pointing out. Compare that increase to 12 positive cases among those in their 50s. Those in their 30s saw a jump of 8 positive cases in the last week. And that's, now it's the main age group that we continue to monitor as the most concerning, as always. And Dr. Whalen will talk about the zip code, which she always does, the 12203, and what's going on with that. And, again, as of August 18th, there were 352 positive cases in that zip code to date. But as of yesterday, the dashboard showing an increase of only 9, which is good. But I'm going to go to the dashboard and and Dr. Willen always gets into the statistics, but again, we tested 2,531 total positive COVID-19 cases in Albany County. And the graph, as we always point out, the graph, and you can see when we hit the apex kind of, when we've gone down, we go up, and then we got more testing, which is good, and that's why we continue to encourage people to go up. The 20 to 29-year-old, if you see the graph here, it continues at 532, and it's really expanding more past any other group, and by leaps and bounds. And again, it's that age group of kids going back to college, going out, that don't have any signs or symptoms. And I'm not trying to scare them. I'm just saying, please do the right thing. Wear your mask. Stay away from people with underlying health issues. Do the right thing, and we'll continue to get through it. And then even if you see the other age group that should be closer to 50 to 59 is 391, and even the 10 to 19 to 170. and then it kind of goes down from there. But again, this age group right here is the one we're concerned with. Continues to grow, just not here, but all over. And again, Dr. Whalen will get into that. But again, total persons tested, 53,937. But if you look at total tested positive, that's, and I'll let Dr. Whalen talk about that, but the positives tested today, but the positive results at 4%, 4.1. But these are things we got to continue to look at. I encourage people to please continue to do the right thing. And again, like a broken record, we will get through this. Dr. Whalen.
Good morning, everybody, and thanks, County Executive McCoy. So looking at the data, and I think we've gone through most of it at this point, I do want to indicate that, when we look at this epi curve, we don't see as much here as we would see if there was a graph representing hospitalizations, which we are starting to see a little bit of an uptick of, and we are starting to see more of the cases that we're diagnosing, which is still a small number, needing hospitalization. This is something that we don't know yet whether it's a trend, and we are actively following and paying attention to that and seeing what information we can get on that. Geographically, we continue to see high rates of COVID, the highest number in 12203. When we look at gender demographics, we see slight preponderance of female, 54% to male, 46%. And when we look at the racial demographics, we see higher rates of hospitalization compared to the county demographics in our African American population. This is something that we have seen throughout the COVID pandemic. If we look at the data from the state dashboard, looking at daily trends, we are still seeing up, except with the example or the exception of the 31st, we're still seeing a high number of people being tested. And there is still widespread availability of testing. I want to say, and I know this is something, again, we have reasserted since we started talking about COVID, we are in an area where testing is readily available. We do continue to advocate for testing for individuals that certainly anyone who's symptomatic, and if you have minor symptoms, and if you are in that age demographic that we discussed, 20 to 29, if you are concerned about contact, or if you just are concerned about your status, please get tested. We do have widespread availability, and we are still testing asymptomatic individuals and still recommending that practice throughout New York State, but especially in Albany County, where we do have availability. The other thing that I think is going to be very important to stress going forward is getting flu shots. We know that the flu season starts in October. It peaks in February. If you get a flu shot today, it takes you about 2 weeks to develop antibodies and be protected. So it is not too early to get your flu shot. Many of the retail outlets in Albany County have flu shot available. We are looking at getting our shipment in the health department next week, and many provider offices are also getting their shipments in. So it's a good idea to call early, get your flu shot, and make sure that you're protected before the flu season starts. We have seen that in the southern hemisphere there was a mild flu season, which is good. It may be due to the fact that people are utilizing protective mechanisms such as social distancing and wearing masks. These are also practices that can help prevent you from getting the flu or spreading the flu, but it is still a good idea to get a flu shot. In terms of the match of what we know will be circulating, it'll be some months before we can comment on that. But we know if you get the flu shot, even if it's not a perfect match, it can mean the disease that you get is less severe than it would be if you didn't get your flu shot. So we will continue this month in particular to stress the importance of flu vaccine. It's also going to be helpful if you get a flu vaccine. We know that we have been told to anticipate a potential second surge of COVID, And it may be difficult for clinicians to differentiate between the two. So offer yourself the protective mechanisms that you can, and that means continuing the behaviors that we've discussed all along of wearing a mask, washing your hands, social distancing, avoiding large gatherings, and that is again particularly important for the 20 to 29 age group, and get your flu shot.
Thank you, Liza, as always. And some of the other questions we've been getting from our workers and from kids that have to go back to school, what school's going to look like. As you know, the plan is not to have 7th through 12th grade go back at all online learning, which makes it difficult for a lot of parents. And the parents that still will be sending kids through K through 7, or 6, excuse me, there's alternate means. They drop off at one school, they get bused to another school, so there's a lot of logistical issues and parents are worried about. We are working with our superintendents, we are talking to them. It's challenging times, and the kids are already 3 months behind where they were when this all started almost 6 months ago. And it's hard to sit here and imagine that next week will be 6 months and we're still into this, and we're going to be into this for a while. I say to the parents, we have children that are already behind on learning and other issues, and kids with special needs we need to address to go forward. We need to make sure that we don't fail these kids that already have been failed in certain areas that are already fighting to get out of certain situations or dealing with certain situations in the schools. And it's tough. I was just reading a story from the BBC online last night, and they were talking rich kids versus poor schools, that they're 27 months behind on the average, 25 to 27. They did a study in 2019, and they're afraid now what's going on, that gap's going to even grow even more. This is something we have to be alarmed about because, again, the world's different. Things are going to be different out there, but we have to adapt. And the one thing I love about this country is we adapt and we overcome, not to sound like the Marines or give them any credit, but that's the motto we have to have with these schools. And we have to address this issue. And I'll say to the parents, I've been reading a lot on my personal Facebook, people that are mad and angry. Be part of the solution, not part of the problem. Let's work on this together, and let's get through it together. And if that means getting tutoring or making sure things are going on, that's stuff we have to address going forward. And some initiatives will be taken in the county for the workforce to help parents that have to stay home with their children. We're going to try to figure that out. And most companies aren't back. I don't think there's, even the state of New York's not back to full capacity. So it's been, I think in a lot of areas it might be easy to address, but in certain areas we have to address people that have to have an alternate schedule to get their kids to schools because they're staggering 8 times and things like that. But again, we can do it working together to get through this together until we get a vaccine. This is the way it's going to be, not unless this goes away. I know doctors from the CDC and other ones have addressed the issue with the herd immunity, meaning that I think it was 60% have to get it in the population to make it,
60 to 70, but it varies.
Yeah, 60 to 70. Again, you think of a population of 330 million Americans, that's a lot of people that have to get it. Considering we've been below 1% or we're at 2 here in the county, morph that number. And then you multiply it, how many people will die. It's something like 1.7 million people would have to die to get herd immunity. Something unacceptable. So again, until we get a vaccine and can do that, we're in this. We're in this for the long game. I have said this from day one. It's a marathon, not a sprint, and we'll get through it. It's we just got to remember, you gotta walk, or we got to crawl before we walk, and we got to walk before we run, and we're barely walking. So we'll, again, stay strong, and we'll get through it. Just one couple final notes. Yesterday announced the 16th and final week of the Albany County Stay Safe Teen Challenge today, the partnership with Albany PAL. Thank you, Albany PAL. Thank you, AT&T, for being there and with PAL and coming up with this to get us through this this health crisis that we're in. And, thank you so much. But living through the crisis that has changed us and have impacted your future career decisions, please, that's what we want to find out. How many people out there decided now they're going into nursing, or they're going to be a doctor or physician assistants because of what's going on in the world that changed your plan going forward to college? We'd like to hear from you. Anyone in general that has just changed in a different ways, please go to our hashtag Albany County Stay Safe by this Saturday, September 5th, and the winners will receive a $25 gift card. And again, this will be our last week doing this, so thank you to PAL and to AT&T. Our mental health support is available 7 days a week from 8 a.m. to 5 p.m. The number, as always, 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. And as always, the New York State hotline and the United Way 211. Thank you to United Way for their partnership. Stay safe and healthy out there,